Hello, welcome to MOT 115, Healthcare in a Transcultural Environment. Today we're going to be talking about the building blocks of what makes up transcultural communications. So first let's talk about cultural values. These are the beliefs and behaviors that are accepted within each community, and these impact communication patterns, both verbal and nonverbal. For example, you see the picture of a guy or a girl holding her thumb or his thumb up. This widely recognized sign of approval or agreement is actually used as an insult in Bangladesh. In certain parts of the Middle East, thumbs up is definitely a highly offensive thumbs down. So, generally accepted nonverbal and verbal communication styles that are common in the United States may actually be very offensive to other cultures. We're going to look at three health belief systems: biomedical, supernatural, and holistic. Starting with biomedical, this is based on the concept a person is a body machine. Kind of thinking that doctors are more like mechanics. This is based on the mind-body dichotomy. The mind and the body are separate from one another, meaning this would eliminate illnesses and diseases that might inherently be caused by stress or anxiety. In this model, disease is caused by physiological disturbances such as genetic disorders, biochemical imbalances, and infectious organisms. Evidence of disease is found in pathologic abnormalities. De-emphasize mental and emotional problems and the psychosocial components of disease. And traditional treatment is medication and surgery. And this approach to medicine is primarily found in Western countries such as the United States, Canada, and most of Western Europe. Then we move into the supernatural belief system. And this is when you have illness is a sign of weakness, punishment for evildoers, or for retribution for shameful behavior such as disrespect towards elders. Some cultures also believe that illness results from being possessed by evil spirits or from an evil spell. Some groups practice medical pluralism, which is relying on Western medicine, but also using traditional healers to help heal the person. Native Americans do this on a regular basis, so they will get vaccinated, they will go to the doctor for their various problems, but they're also using the medications or herbs or chants that their ancestors used to help. So it's kind of add both of them together, and that will help a Native American more than one or the other. Treatments can include prayer, sorcery, magic, witchcraft, religious rites, amulets, masks, and sand paintings. Many Westerners use supernatural beliefs insomuch as they turn to God or a saint to help heal an illness. So especially Catholics tend to pray to certain saints to help them. In addition, you have Hispanics, which again tend to be mostly Catholic, Caribbean and African cultures. And again, it's that idea that if there is something wrong, we need to approach it from both the discrete world, the world of what you can see, hear, touch, and feel, and also the supernatural world of belief that we might have a God intervene on our behalf. Then we have the holistic belief system, and this is often practiced by Asian and Native American cultures. They have become more and more popular in Western societies, emphasizes illness prevention and health maintenance. The concept in holistic systems is that there are natural laws that govern every person and everything in the universe. To be healthy, a person must remain in harmony with these natural laws and be willing to adjust to their environment. Illness, then, results when one does not properly care for the body. For example, too much heat, too much alcohol. The person is failing to act in harmony with nature. Chinese people refer to this as the yin and yang, and if you've ever seen the symbol, it's a circle and half is black and half is white, and they're interlocking. To restore health, the person must restore equilibrium to the body. So if a person has a fever, they would apply cold compresses and eat cold foods. So this holistic belief is not the same as the supernatural, because in that case you're relying on a supernatural or spiritual force to help you, whereas holistic believes that there is balance that has to be restored, or stasis that has to be restored. So now we're going to look at healthcare systems. We have our biomedical healthcare system, popular healthcare system, folk or traditional medicines, and alternative care health system. Biomedical combines the Western biomedical beliefs with the traditional American beliefs of self-reliance, individualism, and aggressive action. Designed to conquer disease and old age. It's based upon the American concept of mastering one's own fate and dominating nature. So what we're looking at in this kind of healthcare system is your traditional doctor, your traditional hospital, the tradition of, if there's a problem, we're going to beat it. You know, you understand the rhetoric that's used when you say, I beat cancer, or, you know, I kicked its butt. You know, there's a kind of an aggressive perspective. So when we are looking at the biomedical healthcare system, that's the one that most of us are very familiar with. In recent years, biomedical healthcare system has incorporated disease prevention and health promotion. It encourages people to learn as much as possible about their condition, as well as doctors being open and honest about the prognosis. In Japan, doctors are often hesitant about being open because they don't want to remove the potential for hope. In Bangladesh, a doctor would tell a patient to eat whatever they want to subtly convey the truth of their diagnosis. So if you think your doctor says, oh, you can eat whatever you want for the next however many months that you have left. Well, most of us, if we knew we only had 6 months left, we would probably indulge ourselves in all of those things that we generally deprive ourselves of to try and stay healthy. And again, what we look at are sometimes, especially in Asian countries, there's more subtlety involved in how the doctor communicates. Western patients are taught self-care, especially with medications and wound care. Whereas in Asian countries, the patient's family is taught these skills because they have that group orientation, that sense of collectiveness. The focus on self-treatment is a hallmark of the popular healthcare system. We're talking about over-the-counter medications, home remedies, first type of care most people go to, no matter what the culture is. This is what they try first. So they don't feel well, they stop at CVS or Walgreens, Rite Aid, and they pick up some over-the-counter meds, you know, sinus medication, stomach medication, headache medication, and only when those treatments fail do the patient or the person call their doctor. This also forms the basis for groups such as Alcoholics Anonymous and support groups. You know, you bring together a collective group of people who may not be experts in a particular field, but can, you know, definitely support one another, but you still maintain that American sense of individuality and freedom. This little cartoon is awesome because I'm sure all of us have been there. I checked my symptoms on the internet and I think I might be dead. So a lot of times doctors will tell patients, don't go on the internet, you'll get freaked out. And the reality is that, you know, if you put in 6 or 7 ambiguous symptoms, it could be anything, which is why we need the doctors. So, on the other hand, being an informed patient is also a very important aspect. So, it is important to understand what's going on with your treatment. Moving on to folk or traditional medicine, we have shamans, herbalists, acupressurists, acupuncturists, and the goal is to treat the whole person within the context of the family. So, these traditional or folk medicines, of course, very popular in Asia and in Native American cultures. You'll see the picture on the top right. This is an acupressure idea of where you would apply pressure to help certain parts of the body. So right around the nose you have the heart and the lungs. At the chin you have your kidney and bladder. Up at the very top of your head you also have your kidneys, and so on and so forth. So when you go to an acupressurist and you're explaining that something in your body particularly hurts, they'll focus on certain parts of your body to try and effect improvement. The consideration of the social, physiologic, and spiritual dimensions of the patient are a hallmark of folk or traditional medicine. Folk healers have a high status in their culture, and many patients incorporate folk medicine either before or after biomedical health interventions. So again, a lot of times you have these cultures that will examine what is the context of their world and apply the traditional remedies that their families taught them. And if it's not working, they go to the biomedical, but that doesn't mean that they're abandoning the folk medicine. They might, in fact, be using them together. Then we have the alternative healthcare system. These are your chiropractors, homeopaths, naturopaths, and hypnotists. Diet therapy would rely heavily on macrobiotics and megavitamins. And the mind-body control methods are very important. Things like relaxation, counseling, prayer, hypnotherapy, and guided imagery. Meditation is a huge aspect of alternative healthcare systems, because if you can learn how to control parts of your body like your heart rate or your blood pressure, then you can in fact make a huge difference to your body, and that mind-body control becomes more and more important. Also, body structure and energy. And this is where you get into your massage, your therapeutic touch, often called Reiki, and chiropractic, which most of us are fairly familiar with. Pharmacologic and biological therapies also include antioxidants, which is the removal of free radicals that can kill off healthy cells. And of course, there are fruits and vegetables and various foods that also contain antioxidants. So for example, I think red wine has a lot of antioxidants, and of course a lot of people will say drinking a glass of red wine is one of the healthiest things you can do. Although, you're still drinking alcohol, you probably don't want to drink the whole bottle every night. Oxidizing agents are used to kill bad cells, like we use peroxide to clean a wound. And then finally, chelation therapy, which is actually very controversial. It's the removal of heavy metals from the system. And chelation therapy has come under scrutiny because young people have been very, very sick after going through it, because whatever they were using to remove the heavy metals counteracted and caused problems within the person's body. So, statistics from a 1998 study, and there's just not a lot of studies out there. So, but 74% use alternative and traditional medications together. In orange, 42% use some of the alternative medicines, and 15% replaced biomedical with alternative. So again, what we're seeing is you might be going to your doctor and you might be getting, treated for slip disc or something, but you're also going to a chiropractor, or you might also be going to an acupuncturist. So these combination of these various and sundry types of medication and types of treatment are usually used in conjunction and not just exclusive to one particular type of treatment. When sick, Asian and Native American cultures are expected to be stoic and silent when in pain. So we think of, you're sick, you're not feeling good. Some people just go to bed and not talk about it. Other people, lose their minds and tell everybody how sick they are. So what we're looking at here is what is considered acceptable behavior for certain cultures. So Asians and Native Americans, they have that stoic, silent, enduring the pain, whereas people from the Mediterranean cultures, like Italians and Greeks, have the tendency to express pain with loud complaints and dramatic gestures. Asians also have a hard time discussing their symptoms, whereas Americans enjoy speaking frankly about their symptoms with a healthcare provider and often with anyone who will listen. Verbal expressiveness. And again, you can't look at every single patient as being a monolith of this is what I expect. Instead, you have to also look at it from the cultural component of what is traditional for this particular cultural group. So now looking at verbal expressiveness, white Americans that tend to use a controlled tone and emotional restraint when they're interacting with a doctor or nurse. Whereas Americans from the South, Asians, and Native Americans tend to spend their time more slowly or talk more slowly discussing what their problem is. You kind of have to pull it out of them. White Americans of Mediterranean descent tend to be loud and dramatic, as I mentioned on the previous slide, and Black Americans believe that emotional expressiveness is valued. Loud volume is not considered aggressiveness. So if you have an African American who appears to be yelling at you, they're not. They're just, expressing themselves emotionally in what is considered an appropriate way for their culture. Americans tend to be very direct in their speech, almost impatient sounding. So again, we tend to expect, okay, here's what's wrong with me and I want to be fixed now. Not 10 minutes from now, but now. Mexicans tend to be overly polite, diplomatic, and tactful. They engage in small talk before getting into an important discussion. So again, especially if you work in the Southwest or the West Coast of the United States, you tend to see a lot more Mexicans than you do on the East Coast. And, they may want to have one of those benign conversations about how are you doing, how's the weather, before they get into what's actually bothering them. French, Spanish, and Eastern European cultures interpret silence as a sign of agreement. And that's something you have to be careful about because, they perceive you not responding as you're agreeing with them. Whereas, if you don't agree with them, you kind of have to be a little more overt in your disagreement. Americans use eye contact as a measure of honesty and integrity, but Asians and Native Americans believe that prolonged eye contact is rude and invades one's privacy. Muslim women avoid eye contact to ensure modesty, which is very important, especially if they come from certain countries in the Middle East, like Saudi Arabia or Yemen, where it is very, very conservative. In India, eye contact depends upon one's social position. People of differing socioeconomic statuses do not make eye contact. So again, in the United States, we don't even really, probably most of us don't understand the different castes that exist in India. But, it's a very important part of the Indian culture, and as such, it's important to learn a little bit about this so you can understand why they may be dismissive of a particular group of people because of the caste in which they were born into. So here are some comics that I think are very appropriate. Top left, we have the use of silence, we have personal space, we have eye contact, cultural interpretations of social issues, nonverbal communication. Look at how the man is sitting. He's got that man spread going on. He's got direct eye contact. His body is reaching towards the woman, whereas the woman has her head down, she's not making eye contact, and she is being silent. So, he may think she's grooving on his, tune, and she's just trying to ignore him. Top right, you have the white person who says, "What a wonderful mop of curls." And then the African American or black person from another country, "I know she means well, but I just wish she would stop. One should not touch people's heads." And that's not just about African American hair. That's also about different cultures where people tend to be darker colored in terms of their skin tones, but they may believe that touching someone's head is inappropriate because that's where the soul resides, and you often see that with patients from Thailand. So then we have international arrivals on the bottom, and you have how people are going to engage. So the white person is saying, "What do I do now?" because he put out his hand to shake his hand. And the Asian person is bowing. The woman behind him is wondering if there is some problems with being unfriendly, and the guy in the middle of the two people are saying, "Wow, that's getting really, really close to me." And then the last guy with the mustache is not sure what to do at all. He's standing there as if he would say hello, and this is from the Indian culture where they put their hands together. So, when we think about the international experience for people who come to this country, there are a lot of rules to figure out. And Americans tend to be, not all of them, but some of them tend to be slightly impatient. They kind of expect you to know everything the minute you get off the plane. So, being considerate, being empathetic, being aware that culture is a difficult thing to learn should help you work with your clients and patients more effectively. So let's talk about personal space, and this is called proxemics. In Western cultures, intimate space is considered up to 18 inches, and this is reserved for people who are in close relationships. Medical professionals must invade this space because of treatment plans. So if you're snuggling, if you're hugging, these are things that you're doing that pretty much are things that you do with your family, your loved ones, the people that you're the closest to. Personal space is between 18 inches to 4 feet, and this is reserved for space between friends and patient counseling. So you should be at least 18 inches to 2 feet away from the patient or your client when you're interacting with them. Social space is between 4 to 12 feet, and this is used in everyday business. You don't want to get too close. Public space is greater than 12 feet, and it's used in lectures and speeches, so there's that distance between the speaker and the people that he or she is speaking with. Americans are very particular about their personal space, whereas people from Latin America, Africans, Arabs, and French people prefer to stand close to one another when talking. So, that personal space that's usually reserved for your friends and family is often invaded by not strangers necessarily, but people you're working with who, that's part of their culture is to stand close to you when they're having a conversation. Here's a little personal space dynamic. So we have our intimate space, which is 0.5 meter. Personal space, 1.2 meters. And then social space is about 3 meters away. And in terms of inches, we already talked about inches and feet. So if you're more of the meter kind of person, there you go. So that's it for today. If you have any questions, please contact your instructor through email or text message. If you are not in our classes but still have a question, please leave a comment and we will get back to you as quickly as we can. Have a fabulous day.